Welcome back to Tales from the Lab, a veterinary podcast. As you may have noticed, we've made some exciting changes around here. I am your new co-host, Dr. Brad Ryan, Senior Professional Services Veterinarian at Antec Diagnostics.
And I'm Dr. Holly Brown, a clinical pathologist and Chief Veterinary Educator at Antec. Together, we'll be discussing real patients and bring in expert guests to offer deeper insights into the laboratory diagnostics used to solve interesting and challenging cases.
Tales from the Lab is a production of Antec Diagnostics. The intent of this podcast is to provide education and guidance with the understanding that any diagnostic testing and treatment decisions are ultimately at the discretion of the attending veterinarian within the established veterinarian-patient-client relationship.
Welcome back to Tales from the Lab. This is another episode on our ongoing series on preventive care. We are today going to take a deep dive on the minimum database and look at the data itself. Let's take a deep dive together, shall we?
When we talk about why in veterinary medicine, why we run laboratory diagnostics, right? We have additional challenges in the veterinary space in that our patients don't talk, right? And often their clinical signs are very non-specific. We have an adage for it, right? We talk about the ADR patient, the ain't doing right patient, because it can be non-specific in that they appear more lethargic or they didn't enjoy their other activity of running in the yard today, or they didn't finish their meal or weren't begging at the table like they normally do, something like that. Very non-specific signs without them being able to tell us really helps us to get objective laboratory data. But even our physical exam that's supposed to have objective components like the heart rate and the respiratory rate, they can show a physiologic response to stress and not actually be underlying illness. Right. So getting laboratory data is always objective, right? An animal can't hide that objective data. And understanding that data and the nuances around it really allow us to get more accurate diagnoses, thus more appropriate treatments with the goal that we always have of our pets living longer, healthier lives. And so, of course, in that ADR patient, that sick patient, we have justification for getting objective data to better understand what's going on. But there's also a lot of value in getting wellness data, right? Of actually looking at the minimum database during times of health, and not just in the older patients, where I'll talk about, we can expect to see abnormalities, right? The studies will actually back that up. As patients get older, it's more common to find, subclinical diagnoses through the lab work, but also in our young patients and truly getting reference values during health. So in some of the earliest literature around wellness testing, right, during periods of health, there was a study published back in 2017, and they looked at 100 healthy senior and geriatric dogs. And by healthy, I mean normal physical exam, owners reporting no problems at home, and not on any medication other than preventatives. And in that population of 100 dogs, 25% had increased liver enzymes outside the reference interval, right? 14% had renal azotemia, and 18% had renal proteinuria. Are you surprised, Brad?
No, I mean, these were not only abnormalities that I saw frequently in so-called healthy patients, but it's I think just kind of evidence of the fact that not only do we have subclinical disease that could be brewing, but we also have just slow progressive diseases as well that can not sometimes even veterinarians miss it in their own pets, right? That we see them every day, and these changes are so subtle that if we're not keeping up with blood work and your analysis during times of health, then we're certainly missing something that's all a story that's already unfolding under the surface, right?
Yeah, and missed opportunity to intercede earlier, right? To keep those kidneys, in this case, feeling as good as possible, as long as possible. And the most recent study, just last year, Morty et al. Published about looking at cats. So they had this big population of healthy, mature, adult and senior cats. So about almost over 250 of these healthy cats. And they looked at them in their lab work over 2 years. And so of those over 250 cats at baseline, when they looked at CBC, chemistry, they added a T4 in these older cats and a UA. 21% had clinical disease at baseline, right? And not just abnormalities outside the reference interval, but an IRIS stage 2 or greater CKD, and undiagnosed hyperthyroidism. And then within that 2-year study, in the select population of adult and senior cats that they were looking at, right, while remaining clinically healthy, 28% of the mature cats and 54, more than half of the senior cats, developed abnormalities during the time of that study. So not just getting a baseline and looking at it even just yearly, but maybe a justification what we see in some of the protocols and recommending more frequent testing as they get even older. These large studies, probably trumped by the largest one I remember that has come out, and that was a publication that AHA publishes now on promoting preventive care protocols. And that references a study where they looked at more than 250,000 wellness visits at over 5,000 practices. And they saw abnormal results on just a CBC and chemistry, right? Abnormal results in 1 in 7 adults, 1 in 5 seniors, and 2 in 5 geriatrics, right? Across the board for dogs and cats. And I mean, again, over 250,000 wellness visits. That is a lot of powerful data, right? To get those significant percentages of abnormalities and not just flagging high or low, but having internists look at that data and say that this was significant and warranted further workup or intervention.
Yeah, when I'm in hospitals, that 1 in 7 number is the one that I really lock onto. And I ask I ask veterinary technicians, veterinary assistants, because they're the ones that are usually in the room first having these conversations about wellness, right? Maybe the receptionist too, but 1 in 7 is not a small number, really, when you think about the number of animals that are in that age group that come through our hospital, and we get that I don't think that's really necessary today answer.
Yeah.
And once again, that whatever is revealed in that 1 in 7, that could mean a diet change, that could mean a medication is needed, it could mean a lifestyle change is needed. But whatever's happening in this early stage, we need to identify that so that it doesn't become a more clinically significant and more expensive problem to deal with down the line.
I think you're exactly right. And so there is a lot of clinical significance, as you talked about, of ways that we intervene and change the clinical picture for that pet based on getting that data. But there's also a lot of data and a lot of power and value in having wellness lab work to get just true baseline values of true health. So not just uncovering pathology, right? But actually having true wellness data points. And I say that because having been a part of some reference interval studies, right? The currently reported reference intervals that you see in your lab work from the lab are going to be population-based reference intervals. And by that, I mean, we're taking hundreds of healthy dogs or cats or whatever species, right? Deemed healthy again by normal physical exam, no abnormalities noted by the pet owner, and on no medication other than, preventive care. And so in these populations, they will do all the different measurements. If we're doing a chemistry study, let's say, or a hematology study, right, you'll have all the different measurements that are reported by your analyzer, right? And they'll distribute the population of all of those pets, these healthy pets, across what we would say like a spectrum, right? Of like we'd look at their hematocrit numbers across the spectrum. We'd look at their creatinine numbers across the spectrum, right? And if they were normally distributed, you get that Gaussian shaped curve, that nice even curve. It's never that perfect, right? But it outlines the fact that in the middle, most of these animals are going to have data points right there in the middle. And then there'll be fewer that are at the high end and fewer that are at the low end. And sometimes especially because we don't have a visual on the audio part of this podcast, but I try and explain, like in that curve, we can imagine those tail ends at the high end and the low end, right? Where very few healthy pets are going to have a hematocrit, let's say, of lower than 30% or higher than 60%, right, out on these tails. And the reference interval is established by finding the mean value, right, of that distributed breadth of results, and then taking 2 standard deviations above and below to give us the 95% middle values. Right. And that's what's generally reported, right? It might be tweaked by some statistics, but that's generally what's going to be reported as the reference interval of health. And so what that means is that both during periods of health, you will have 2.5% of the population at the low end and 2.5% of the population at the high end that are actually in health outside that reference interval, right? But that's normal for them, right? But it also means in that vast breadth, let's say again of hematocrit, maybe between 37 and 60, right? Maybe for a dog, whatever the lab's reporting, there is a wide variety there, such that a patient might normally have a hematocrit of 60. And when they're presenting at your hospital after having lost like a third of their blood volume, right, it might still not flag as low and be within that reference interval, right? So it can be very insensitive in detecting abnormalities for an individual patient. How well those population-based reference intervals work depends on the measurement that we're looking at, right? Because if we're talking about these wide reference intervals, if we take a measurement like glucose, and glucose for an individual animal will vary sort of widely through the day based on postprandial times and times of fasting, right? And so a wide population-based reference interval is likely to catch and represent all normal points of glucose for an individual patient. But if you take something like creatinine as a measurement, right? Creatinine as a biomarker that's representative of muscle mass, right, of an individual patient. Obviously, that's quite an individualized value for an individual patient. And it does not change through your days or weeks, right? Other than based on your hydration, right? Assuming your muscle mass is not changing dramatically. And so they are so different from each other. There's so much variability, right? If you take something like a Staffordshire Terrier next to a teacup poodle, right? You can imagine their creatinine level based on their muscle mass is going to be very different. And so that creates a very wide reference interval that is not very powerful in looking at an individual animal's number and trending that. Does that make sense, Brad?
That makes sense. Yes.
Where I find it's particularly hindering is when we go to interpret, let's say, a chemistry profile. And so if I take something like how I'm taught to look at a liver value like ALT, right? We don't end up attaching too much significance to a mild rise in ALT, but if it gets over, 3 times the high end of the reference interval, then we're really concerned about significant hepatocellular necrosis, right? But if we think about the variability in ALT between patients and the resultant wide reference interval during periods of health, it means you could have one patient who normally rides at the low end of the reference interval. And if he or she were to have a 3 to 4-fold rise in their ALT because of significant hepatocellular necrosis, we may not catch that outside the reference interval, right? Or not at 3 to 4 times the high end of that reported reference interval. We're missing things, right? Being my point there. And yeah.
I was going to say that's the graph that made me look back on my life with a lot of, oh no, to be honest, because, and I wish that everybody could see this graph. They certainly do when the professional services veterinarians are out in the field, we show this exact graph because it's just such an eye-opening and it's such an eye-opening reality check that, wow, like just do not get so caught up in these reference ranges and go down. Scanning for the red is not the way. It's too simplified, and you're missing potentially some major clinical problems that are unfolding for this patient.
Yes, and how you're going to then see those is not being reliant on population-based reference intervals and one-time
Yep.
snapshots, right? But it's to have periods of wellness data, right, where you truly know what's normal for that patient. So again, we're talking to an owner and trying to talk to them about why we want wellness data. It's not just because of those studies that say we're going to find things that we didn't know were there. Right. But we're also going to have this opportunity then to say, well, we know it's normal. We've honed in normal. Right? An example I'll use is we have this patient at our hospital that we had seen repeatedly, had orthopedic issues, was on some medications and had surgery. And so we have a lot of time points of their chemistry data. And we know for this particular patient what his lipase level is, his total lipase, where his reference interval of health is, because again, of these 5 or 6 data points we have over the past year and a half. And when he came in with GI signs on a particular day, right, and we see this rise, right, in his lipase levels, it is not at the 4 times, 3 times the high end of the reference interval that adds specificity to pancreatitis in that diagnosis, right, for if we looked at the high end of the reference interval. But if we looked at this patient's lipase historically, this was like a 5-fold jump for him, right? And actually does support the diagnosis of pancreatitis and adds that specificity to that data. So again, telling these pet owners that having wellness data and those periods of health is super, super important. And then I think sometime that it's really powerful is when we think about cats, right? And we know from those studies, right, that we're uncovering occult renal disease, and catching that early is going to make a difference, right, in the health of those kidneys when we can intercede earlier with diet changes, et cetera, that we talked about. And often if we look back and we trend an individual cats as they age, their creatinine level, we can watch it creeping up, right? We can watch the creatinine creep up and it's not because they're gaining muscle mass, right? But it might take an extra year or 2 to get outside the reference interval to flag high to let you know that there's an azotemia. But if you had those wellness periods before, you could catch it earlier with earlier intervention. Or if you were looking at hematocrit, which would also be slowly dropping, right, for these cats in chronic renal disease, or looking at their urine specific gravity, right? You don't know where you're going to get the most value, and running the whole minimum database gives you all of those values to put together, if that makes sense.
I'm just going to say, it's when we're trying to have this conversation with the general public, it's easy to understand why an owner would be looking at their pet and say, "Hey, this is a 2-year-old dog, 3-year-old dog. There's not, we're eating every day. We're taking nice long walks. He's panting and smiling and all these things. We're this is a happy, healthy pet." And what I try to say is that you're not concerned right now. This is what I would tell owners, right? I can understand, you're here for a healthy wellness appointment, but one day you will be coming in here and your pet will be sick and you're going to be very frantic and you're going to want us to be able to diagnose your pet's illness, right? And so what you're doing is, they're perceiving it as perhaps a waste of money because their pet is completely healthy. But what they're actually doing is investing in your long-term capability as a veterinarian to make accurate and timely diagnoses. And so you're really investing in a long-term data set that gives your veterinarian the power to figure out what's wrong with your pet when you're going to want them to be able to figure that out in moments of absolute stress and distress, right?
You couldn't say that better myself. Yeah, no, that is exactly right. It's an investment, right? We want to make sure we set the expectation with the owner, right? So that they are getting the most value, we hope to not find abnormal values, right? That isn't actually the point. The point is, while you're telling me they're healthy, we are going to establish what health looks like repeatedly, hopefully over the next few years, right? Without seeing any changes, right? But then you're really investing in the power of that data, right, to help us make those more accurate diagnoses down the road. Yep, that's it. That's very, very well said.
And also, when we were talking about that 1 in 7 healthy adult aged animals having something that gets revealed on that minimum database that requires some intervention on our part, when it does come back completely within normal limits, we've also invested in some peace of mind at this particular stage in time that
Yeah.
we're not that 1 in 7. So it's kind of there's a double benefit there.
Yeah, and it should be celebrated, right?
Yeah.
Right. It shouldn't be thought of as a waste of money, but actually a celebration of that health that you've verified with objective measures, right? Just like when we got our lab work done, right, with our doctors, right, on the human side of things. And so I think about when in our communicating to owners and as we look to engage in more preventive care diagnostics in our practice, right, to better serve our patients and better serve our clients, to keep them more informed, I think making sure we're speaking to this objective assessment of their health, right? We know we're pairing that with our infectious disease screening, which we've talked about in the previous episodes, which not only inform us about the risk for that patient, but for the two-legged persons in the family as well, right? And then that investment in establishing what's normal for really honed in patient-specific reference values, right, of health. And then as we think about communicating that, what can be most effective, and we'll do a further episode in speaking with Dr. Jason Coe, who really leads research around that relationship-centered veterinary medicine and how we communicate most effectively with our pet owners. But it's really about understanding their values and speaking to them, and it's always going to be about keeping their pet as healthy as possible, as long as possible. And so making sure that we talk to each other in the veterinary space about the power of that data and honing in a reference interval. That means nothing to them, right? They
Right.
want to
It
know what
doesn't.
it means for making their pet have a longer, healthier life. And so make sure we're always including that in our conversation with them.
Yeah, I love it, Holly. I mean, this is a topic that is pertinent to every single veterinarian in the world and every member of that hospital. That's the other thing, is that, when we're gonna the conversations that I have all the time revolve around, those clients that just wear us down with their nose. And it can become sort of a helpless feeling. You just see the name on the calendar and you assume by the time they walk in, you've already got the answer before you even open your mouth. And the truth is that sometimes we're just not communicating all the nuances of the value of this data. And if we say it a different way, if we say it If we explain it more clearly and if we explain it consistently year after year, a lot of times the answer does change.
Great. And that consistency in message is not just the responsibility of the veterinarian, right? But it's throughout the hospital, right? And the team, right? It starts with the CSRs in setting the expectation, the technicians and the assistants that come behind them and have those next conversations, who are often having the most lengthy conversation with these owners, who understand their values probably the most, right? And then backed up by the veterinarian coming in and talking truly to that value and showing that data, right? Showing them those results that they've invested in so that they're invested to see next year, right? That they're not seeing a rise in something that's of concern or a decline in something that's of concern. Listen to new episodes of Tales from the Lab wherever you get your podcasts. And now you can also watch us on YouTube and Spotify.
Be sure to like and subscribe for exciting new content. Share new episodes with your colleagues and follow us on Instagram at Tales from the Lab. That's TAILS from the Lab. We're grateful you're here.